Hello, ma'am, sir. So today you came in for your routine pregnancy checkup, am I right? Yeah. So we took your genetic testing and background survey, and I regret to inform to you that you have been exposed to a teratogen. Now, I know what it feels like to have something happen to you and you have no idea what's gonna happen to you or to what's developing in you. Um, So I am here to help, and I have this information for you, and I hope that it will help relieve your stress, that might have just been, popped up, because this can be a hard thing to understand, but I can help you with that. So you must be wondering, what's a teratogen? And so teratogens are drugs or chemicals that that have been exposed or you've taken into your body. They can also be infections sometimes, and they can cause abnormal fetal features, especially to your baby. This is regarding pregnancy, as you are of right now. If you aren't pregnant, this teratogen that you've been exposed to actually is to treat a disease called endometriosis, and I will get into that further along the way. So what teratogens can do basically is change maybe something physical or mental, not more mental, more like internal, external development in or outside of the baby. So this teratogen that you've been exposed to is called danazol, and danazol is an androgenic hormone, which is another word for a male hormone or male characteristics. So and I'm guessing you might know now why this is used to treat endometriosis, which is usually a disease that forms in the female body, and it is used to treat endometriosis by shrinking the displaced tissue in your uterus, and it will be in waste along with your stool, and it usually takes action between 3 to 6 months, sometimes 9 months. This is why we have to make sure you're not pregnant, because if you take danazol while you are pregnant, it can really cause some damage to the baby, and it is not good. Let me give you an example. This is endometriosis, and right here is the uterus of the female body, and right here you can see the displaced tissue in the uterus and a little bit outside the uterus. So what danazol will do is shrink that, and it will be in waste along with your stool. So what danazol can do to your fetus is infertility as your baby's growing along. That also reminds me that this medication, danazol, is also known as a medication. What's it called? It is usually affecting only the female fetus. So if you're having a baby girl, your daughter will experience a lot of these problems, but we will get through them together. But if you do end up having a boy, then danazol won't have big effects on your son, more like just a little bit of extra genes, I would say. So what danazol again would do to your female fetus is infertility as they grow older, excessive acne during puberty, decrease in breast size, another big physical change, excessive weight gain, which is also another physical change, and excessive sweating, also again during puberty. Danazol may also decrease the effectiveness of hormonal contraceptives like birth control, rings, patches, implants, or injections. Again, keep in mind that this all happens to the female fetus, and that if it happens to the male fetus again, it won't hurt it at all, but it will just help it a little, I guess you can say. But again, this is also still a very dangerous medication, and that you should always talk with your physician about. This is not safe for you nor your child to take ever in the future unless you're treating endometriosis. So the reason why that doctors use danazol to treat endometriosis is because of the male characteristics, the male hormones, because again, it is in a female body, so it has a different surrounding, and therefore it will start by shrinking, again, the displaced tissue. So what you should know is that when your daughter will grow older, if you do have a daughter, she will be built in size. So she won't look like the average woman like you are and myself I am today. Your daughter will look a little more muscular, a little more bigger, I would say, and a little more taller than the average woman. Some long-term effects that your daughter, if you do have one, again, my experience, is menstrual abnormalities, which are usually increased by 79%. So you have to go to your local pediatrician or physician about that. And muscle cramps, which is usually increased by 40%. So you also have to be careful about that one, as those can be very, very painful for your child to experience. As again, this is a picture of endometriosis happening in the female uterus. And the treatment options for endometriosis, besides using danazol, so the safer ways are surgery, self-care and resting, and other medications and hormones that you could take, prescribed again by your doctor. You have to make sure you safely treat endometriosis, especially because, again, danazol is dangerous. So some extra things that you should know about danazol to keep in mind for the future is that when you're, again, if you have a girl, when your daughter hits puberty and starts going through their menstrual cycles, the average teenage girl's menstrual cycle is 2 to 5 days at the beginning, and it will sometimes progress, sometimes stay the same. I wouldn't say long, I would say the regular normal menstrual cycle is a 7-day period, but your future daughter might experience only 1 to 2 days of this menstrual cycle, then it will stop so much earlier than other teenage girls, and it will come back in another 1 to 2 months. Usually the period happens, every month. So your daughter will have their period every month, sometimes every other month, or sometimes they would have to wait maybe a 2 to 3 month time period before they get their next period. Sometimes they won't have it at all, and you should check with your pediatrician by the time they're 13, especially if they still don't have it. Again, because of the menstrual abnormalities, you have to keep in mind of that. Their muscle cramps, again, are still going to be very painful, so you have to watch out for those, and their menstrual cramps. And even though it's only 1 to 2 days, it can still be very painful. Their decrease in breast size may also be a big problem, so you will have to go to your local pediatrician or physician, and you also have to talk with your daughter. You guys can do whatever you would want to, but again, this is a very big physical change along with weight gain, so your daughter have to watch what they eat and to see if they have a fast metabolism or not. But because of this, your daughter's metabolism might be a bit slow, and you have to watch what they eat, and you also have to bring it up with your local doctor. Well, that's all the information I have for today. Thank you for coming in. I'm so sorry that this has happened to you, but me as your OBGYN will help you get through it. And again, go to your local pediatrician or physician if you have any questions, if I am not here to answer. And again, you can only search the internet, but if you are unsure about something, please call us. Thank you for coming in. I hope you have a good day. Stay safe out there. And again, more questions, just call our office. Bye.